Order. The table has been advised that PQB 398 has been withdrawn. MP Lobin.
B394, please.
Mr. Speaker, sir, I presume that the honourable member is referring to a press article which mentioned alleged gang fighting among inmates in the central prison Bobassin in April 2023. As a matter of fact, the Acting Commissioner of Prisons has informed me that the incident was actually a spontaneous fight among some detainees. It occurred on Sunday, 2nd of April 2023, at around noon, in one of the association yards of the central prison Bobassin, where detainees were gathered after their meal had been served. One detainee, on remand, attempted to snatch from two other detainees goods purchased by them from the canteen. When they resisted, he assaulted them. Some inmates intervened to prevent this detainee from doing so, but the latter was supported by other detainees who joined in the fight. The lead prisons officer, who was on sentry at the association yard, raised the alarm to summon assistance. All evening shift prison officers, including those in the prison security squad, were immediately deployed to the association yard. The Correctional Emergency Response Team, along with dog handlers and intelligence officers, also promptly intervened, and the situation was brought under control. The lead prisons officer and 4 detainees sustained injuries. Mr. Speaker, sir, I am also informed that further immediate actions were taken as follows, namely, 1. The lead prisons officer and 4 detainees who sustained injuries were dispensed first aid treatment by the prison health service officers. 2 of the detainees were referred to the Jawaharlal Nehru Hospital for further treatment, and 1 of them was admitted thereat and discharged on Tuesday, 4th of April. 2. A head count was carried out, and all detainees, except those referred to the Jawaharlal Nehru Hospital, were locked up as a security measure. 10 of the 11 detainees who were involved in the fight were segregated in another block. And 3, a thorough search was carried out in the said association yard for the purpose of identifying unauthorized items. Mr. Speaker, sir, I am informed that on the following day, 10 of the 11 detainees who were involved in the fight were transferred to other penal institutions and segregated thereat as follows: 3 to the Phoenix prison, 3 to the Special Protection Unit at the Eastern High Security Prison Melrose, 3 to the Special Protection Unit at the Central Prison Bobassin, and 1 to the Special Protection Unit at the Grand River Northwest Remand Prison. The detainee who was admitted to the Jawaharlal Nehru Hospital was, on his discharge on 4th of April 2023, segregated at the Special Protection Unit at the Central Prison Bobassin. I am also informed that the matter was referred to the Berkeley Police Station and that the police inquiry is in progress. In addition, the Prisons Department had instituted a departmental inquiry to look into the circumstances leading to the incident and to submit its findings, including recommendations and further remedial actions. During the course of the inquiry, statements were recorded from all prison officers and the detainees present at the time of the fight. Mr. Speaker, sir, the departmental inquiry identified 5 detainees as the main instigators of the fight and found that the prison staff promptly intervened and restored order and discipline in the association yard. The departmental inquiry has come up with the following main recommendations with a view to further beefing up security at that prison. 1. Reinforce supervision in association yards. 2. Detainees coming from the same locality be detained in different association yards or institutions. 3. Correctional Emergency Response Team officers and intelligence officers to be deployed during the distribution of meals to supervise movement of detainees. 4. Regular searches to remove any unauthorized items. And 5. Welfare officers to organize more activities like indoor games, football and volleyball for detainees. These recommendations are being implemented by the Prisons Department with due consideration of operational needs. Mr. Speaker, sir, the Prisons Department has been proactively taking a series of measures to enhance safety and security in our prisons and for the rehabilitation and welfare of inmates. These measures at the same time contribute to minimize the risks of group fighting in prisons. Security measures in place in prisons include the following. 1. Searches on all persons entering or leaving the prisons. 2. Search of cells, workshops, and areas within the prison perimeter by the search team. 3. Use of CCTV surveillance cameras in blocks, yards, and workshops. 4. Use of body orifice security scanner chair to detect hidden metallic prohibited articles in body cavity at Eastern High Security Prison, Beaubassin Prison, New Wing Prison, and Women Prison. 5. Escort under close supervision of detainees attending public hospitals and other places. 6. All detainees requiring admission in public hospitals are directed to one specific hospital, that is at Jawaharlal Nehru Hospital, except for specialized care where special security arrangements have been made for control purpose and for access to the public. 7. Use of sniffer dogs for the detection of mobile phones and drugs, and of handheld metal detectors to detect metallic objects. 8. Regular patrols within the prison premises to discourage pelting of drugs. 9. Intelligence gathering by the Prison Intelligence Unit to prevent drug trafficking in prisons. 10. Discreet use of mobile phone detectors on officers during parade. 11. Regular strip searches on officers suspected to be introducing prohibited articles. 12. vehicular patrols in the main roads surrounding prisons, 13, regular reshuffling of officers irrespective of their ranks, 14, surveillance through watch towers, 15, segregation of detainees with aggressive attitude in segregation and protection units, 16, installation of a full X-ray body scanner at the central prison, Beaubassin, since 14th of February 2022 for detection of prohibited articles. A contract has already been awarded for the procurement of 2 additional such equipment, which are expected to be delivered in June of this year. Mr. Speaker, sir, the role of prison staff is to uphold safety and security in prisons, while at the same time work towards the rehabilitation of detainees. As such, ongoing staff training constitutes an essential tool in the achievement of the objectives of the Prisons Department. In order to render rehabilitation more effective and reduce recidivism, it is important that the criminogenic needs of offenders, that is, those factors in an offender's life that are directly related to recidivism, are targeted and addressed. This necessitates staff who have been specially trained in this field. I am informed that the Mauritius Prison Service is considering the possibility of prison officers undergoing a training of trainers program with a view to addressing the criminogenic needs to reduce reoffending. The Prisons Department firmly believes in the rehabilitation of detainees with a view to facilitating their reintegration in the community. In this context, the department carries out a host of rehabilitation programs for the benefit of detainees. The rehabilitation programs are carried out either in-house or with the support of non-governmental organizations and other governmental organizations. And some of these programs include anger management therapy, stress management techniques, pre-release and post-release scheme, suicide prevention, breathing techniques, positive thinking, yoga and meditation. In addition, detainees also benefit from vocational training on pastry making, masonry, garment making, amongst others. They also participate in recreational activities, numeracy and literacy activities, in sensitization campaigns on HIV/AIDS, in agricultural farming, and in faith-based programs and activities. Thank you.
Yes, thank you, Mr. Speaker. The Honourable Prime Minister has pointed out the several measures proposed by the Prison Department. Is the Prime Minister aware that the Lam Shangling report way back in 2018 pointed out that there is a strong correlation between gang fighting, drugs and corruption in our prison system? And is it not high time to have an independent assessment as to how our prison authorities are operating in this climate of drug, corruption and gang fighting affecting our prison officers who are also working there?
Yes, Mr. Speaker, sir, I am aware of the recommendations of the report of the Commission of Inquiry on Drug Trafficking. And in fact, in line with these recommendations, the Declaration of Assets, Mauritius Prison Service regulations were promulgated with effect from 4th of April 2022 for every officer of the departmental grade in the prisons department to make a declaration of his assets and liabilities, as well as those of his family and close relatives. And out of the 61 recommendations made in the Commission of Inquiry on Drug Trafficking report of July 2018, as at date, let me inform the House that the status is as follows. 43 have adequate measures in place, 11 have already been implemented, 5 measures are not feasible, and 2 measures are pending implementation. Now, further, there is, of course, a regular monitoring of some of the criminals, especially those who have been convicted of drug trafficking. And it is good for me to inform the House that from the information that has been relayed to me by the Prisons Department, that since 2015 to date, 15 officers from the Prisons Department have been arrested or convicted or interdicted or suspended for drug-related offenses. 18 prison officers have been mentioned in the report of the Commission of Inquiry on Drug Trafficking, and a task force which has been constituted under the chair of the Director of ICAC for the conduct of inquiries on cases that have been identified in the report, and the cases of the 18 prison officers are being followed up by the ICAC and the police. So, yes, there are cases which have been found, fortunately, and those cases, as I have said, have been reported for inquiry, and of course, I don't have the breakdown of how many have already been convicted, but this is the, in fact, I just asked the prison department to communicate to me those figures.
Mr. Speaker, may I ask the Honourable Prime Minister, with regard to leadership within the prison services, why is it that after 3 years we have got a Commissioner of Prison who is on actingship? We do not have a full-fledged Commissioner of Prisons on a substantive capacity. Why is it so?
Well, when one is on actingship doesn't mean to say that he is not performing. He is assuming his responsibility. In fact, quite a number of measures have been taken. I have said in the House that all these measures that have been taken, so, well, we'll see in time to come whether he will be, who is going to be the Commissioner or not.
Thank you, Mr. Speaker, sir. In his earlier reply, the Prime Minister gave a breakdown of detainees that has been segregated. Can the Prime Minister thus give us more information on the type and basis on which these detainees are considered for segregation? Thank you.
Yes, Mr. Speaker, sir, the following types of detainees are considered for segregation. Those who have committed aggravated prison defaults, those who have been persistently committing minor prison defaults and thus are in fact exercising a bad influence on other detainees, those who are of bad character and might endanger the security of the prison by instigating other detainees for misconduct, those who are suspected of brewing trouble where they are located and thus exercising bad influence on other detainees, those who need to be segregated for their own protection because their security cannot be fully ensured in the residential units, those who are suspected of or convicted for having committed serious criminal offenses and are a constant threat for the public safety, those involved in high-profile cases, and those who may tamper with evidence directly or indirectly, by influencing witnesses or co-accused in custody to plead for their cause, those who are highly suspected to be indulged in trafficking in prison, and those who apply to be placed in segregation for protection. Of course, this is something that is considered, and decision is taken ultimately. It is not merely on demand. So segregation may be in the form of transfer to another prison or to another unit within the existing prison.
Honorable Badar.
Thank you, Mr. Speaker, sir. The Prime Minister mentioned a spontaneous incident. I asked him whether it was a spontaneous incident or whether it was a règlement de compte between gangs involved in drug trafficking within the prison. And the second thing I would like to ask Mr. Speaker.
One by one. This is supplementary question.
Well, Mr. Speaker, sir, I have answered from the information that has been relayed to me, and it is not only from an inquiry which has been conducted, of which I have the report, but it is also from my meeting with the Acting Commissioner of Prison to, especially in the light of this question, to be able to be provided with all the information. So, of course, I had a number of questions also, and supplementary questions which I asked. So, but to me, this is the information that has been relayed to me, that it was out of a spontaneous act. With regard to meals, in fact, as I said, one person attempted to snatch from two other detainees goods that were purchased by them from the canteen. Maybe for the information of the House, it's good to know that, of course, all the prisoners are provided with meals, but there are those who do additional work of their own will. Of course, they are paid, and with that money, they are able to purchase some goods from the canteen. I believe, I say, in this case, that was the reason why that prisoner wanted to snatch those well, they were meals from those two persons. So, but if the honourable member has information to the effect that could be or could have been a matter of some people getting fighting against another for whatever reason he is aware, of course you can provide me those information. I will of course look into it.
The table has been advised that PQB 403, 404, 407, 409, 411 have been withdrawn. Honourable Mayot.
B395.
Yeah. Mr. Speaker, sir, under section 143 of the Criminal Code defines riot as, I quote, unlawful assembly which has begun to execute the purpose for which it is assembled by breach of the peace, unquote. Under this section, any person who takes part in a riot shall be liable to a fine not exceeding 100,000 rupees and imprisonment for a term not exceeding 10 years. Moreover, section 139 of the Criminal Code defines unlawful assembly as 12 or more persons who A. are assembled with intent to commit an offense, or B. being assembled even for a lawful purpose, conduct themselves in such a manner as is likely to lead to or provoke a breach of the peace. Under this section, any person who takes part in an unlawful assembly shall be liable to a fine not exceeding 100,000 rupees and imprisonment for a term not exceeding 5 years. Mr. Speaker, sir, I am informed by the Commissioner of Police that for the period 2005 to 2009, 7 cases of taking part in a riot and 4 cases of participating in an unlawful assembly have been reported to the police. The cases of taking part in a riot are as follows. In the year 2006, 1 case was reported to the Sudnak police station on 14th of November 2006, whereby a group of about 300 persons had gathered at corner Western Boundary and Palma Road to protest against the interruption of water supply in the locality, and who had obstructed the road with burning tires. 6 persons were arrested and all of them were fined. In 2007, the following 4 cases were reported. 1 on 4th of January 2007, 1 case was reported at Saint-Pierre police station, whereby some 300 residents assembled on the road at L'Avenir, Saint-Pierre, due to stoppage of water and burned old tires. 4 persons were arrested and all of them were fined. 2, on 11th and 12th October 2007, 2 cases were reported at Bel Air, Rivière Sèche police station about some persons who were obstructing the road at Écoignard due to shortage of water. 6 persons in all were arrested and all of them were fined. So on 23rd of December 2007, 1 case was reported at Black River police station, whereby 150 adults had gathered and obstructed Royal Road Tamarin with stones following a fatal road accident. 7 persons were arrested and all of them were conditionally discharged. In the year 2008, 1 case was reported at Brisé-Verdière police station on 2nd of November, where several persons were gathered following a road accident and stones and wood were placed on the road. 23 persons were arrested, 22 of them were fined, and 1 was conditionally discharged. And in 2009, 1 case was reported at Médine-Camp-de-Mas police station, where about 300 persons gathered and obstructed the main road at Médine by setting fire on tires, throwing stones and other projectiles at police vehicle following a case of assault. 4 persons were arrested and all were fined. Mr. Speaker, sir, concerning taking part in unlawful assembly, the following were reported. In 2007, a case was reported at Phoenix police station on 22nd of October, where a group of persons unlawfully assembled and obstructed the free passage of motor vehicles with stones and burning tires near the roundabout of Pontfair, Phoenix, in both directions and along the road leading towards Valentina. The incident occurred due to sewerage overflow coming from the industrial zone Phoenix, which was affecting the inhabitants in the vicinity. 1 person was arrested and 1 was fined. In 2008, a case was reported at Bakwa police station on 29th April, where a group of 50 Chinese workers armed with iron bars unlawfully assembled as their colleagues were assaulted by 3 Mauritians. There was no arrest, and the case was filed in December of the same year. And in 2009, the following 2 cases were reported. One on 20th of April at Popenisi police station, whereby about 100 persons, including hunger strikers of sale by levy cases, assembled unlawfully at Sir Virgil Naz Street, Port-Louis. 33 persons were arrested and all were fined. And on 17th of August at Lalmati police station, whereby about 20 persons gathered in protest at the CWA office of Lalmati for complete stoppage of water supply in the village. 7 persons were arrested. However, the Office of the Director of Public Prosecutions advised no further action.
Thank you, Mr. Speaker. Second, the Honourable Prime Minister indicate if some properties were looted during those riots you just mentioned.
Well, there were in some cases, but Mr. Speaker, sir, it would not be good for me to mention any of the particular case because I can recall from memory, having read that there are in some cases, but I cannot recall in which case, but there have been cases, certainly.
Can the Honourable Prime Minister indicate the number of hold-ups also registered that same period, that is 2005-2009?
The number of?
Hold-ups.
Hold-ups. Well, hold-ups, I wouldn't have the information because that would relate to another question. The Honourable Member can put a specific question about hold-up.
The table is advised that PQB 406 have been withdrawn. Time over.
B413.
Mr. Speaker, sir, I wish to refer the honourable gentleman to my speech during the debate on the Supplementary Appropriation Bill on 4th April 2023. On that occasion, I explained that government decided to entrust the construction of 8,000 social housing units to quote-unquote large contractors, building and civil works, registered with the Construction Industry Development Board at a predetermined cost of 2.7 million per unit. Thereafter, discussions were held with the said contractors to gauge their interest, and a selective bidding exercise was carried out. As a result of the 19 CIDB registered large contractors, 14 qualified. I am informed that further to discussions with the said contractors, and in order that they should conform to the predetermined cost and time frame, the Board of the NSLD, after seeking appropriate technical and financial advice, decided that an advance payment facility of up to 25% of the contract amount, less contingencies, if any, would be offered as against appropriate guarantee, and this would be extended to all contractors invariably. Accordingly, the letters of intent issued to all 14 selected contractors do provide for the said advance payment.
In all government contracts, after due tendering process, the maximum amount of advance payment that is made is 10%, as recommended by FIDIC, Fédération des Ingénieurs Conseil. This time, it is being enhanced to 25%, which will mean, can I ask the Honourable Minister, being given the large contracts involved, we are talking about 5.4 billion rupees of advance payment. If you go for 25%, multiply by 8,000 units by 2.5 million rupees per unit. What guarantee, what arrangements has he made at the level of the NSLD and his ministry to ensure that these contractors are fit to receive this huge financial package, being given that even some of these contractors that he has referred to have not filed their latest financials at the Register of Companies?
Mr. Speaker, firstly, I understand the question, and the concern is legitimate. As I have always said, we are talking of large amounts, and we're talking of public funds. Secondly, I wish to point out that I have not made any arrangements. The Honourable Gentleman said, has he made? I am the Minister in charge of the Ministry of Housing. I have oversight, but I do not run the NSLD. These matters have been handled by the NSLD with appropriate support and advice from the Ministry of Finance. The question for government was whether we could go forward or not with the project to build a large amount of social housing units. Despite the difficulties posed by COVID and ensuing events such as the war in the Ukraine, the disruption of global supply chains and value chains, translated into the increase of at least 30% of construction costs. We have discussed this. It was not just a matter of affordability for the state, but also of eventual affordability for the most disadvantaged sections of the community. So had we stuck to the traditional approach with consultants, PMCCs and so on, had we stuck with the standard pre-COVID conditions of 10% advance payment, certainly the project would have gone nowhere. And I'm sure the Honourable Gentleman would agree that the priority is to offer decent and adequate social housing to the poorer sections of the community. So government had to ensure that this project could be realized, albeit in phases. Now, for that purpose, a predetermined cost was set, and discussions with eventual contractors indicated that there would need to be some assistance to allow these contractors to meet the financial challenges and conform, on the one hand, to the predetermined cost, and on the other hand, to the predetermined time frame, the contractual time frame. Hence, the provision for 25% advance payment against a bank guarantee or a guarantee from an insurance company. So the guarantees are being insisted upon, and appropriate steps taken, I understand, from the NSLD to ensure that whatever outlay of public funds is effected, there is adequate protection.
Honourable Minister, I beg to differ.
No,
For all contracts...
Honourable...
Yes, okay.
Listen to me. Honourable Osman Mohamed, this is not a debate.
Sure.
Whether you agree or not agree, come with question, come with a specific question, linked with the main question.
Even for the biggest contracts and the most complex one, FIDICS, Fédération des Ingénieurs Conseil, limit it to 10%. Can I ask the Honourable Minister, why is he not comfortable with starting with 10%, and not taking the risk that contractors taking huge amount of money and bolt away, and to make sure that progressive payment is being done au fur et à mesure that the work is being done? This is you don't need to be...
You put your question.
I stand guided by the experts. The formula has not been worked out by me. I have not done the arithmetic the honourable gentleman has done. And I can only say that according to the advice tendered to me, this is the approach that allows for us to go ahead with the project.
Honourable members, the table had been advised that PQB 440 will be replied by Dr. the Honourable Minister of Finance, Economic Planning and Development. PQB 475 will be replied by the Honourable Minister of National Infrastructure and Community Development. Next question.
B414. Mr. Speaker, sir, in reply to part A of the question, I'm informed that in regard to COVID-19, a total of 185 patients were admitted at ENT hospital as follows. Month of March, 48, April, 119, from 1st May to 4th May, 18. Mr. Speaker, sir, in reply to part B of the question, 33 positive cases of XBB.1.16 Omicron variant have been reported as at date.
Thank you, Mr. Speaker. The Honourable Minister is surely aware that this particular variant, XBB 1.6, also known as Arcturus, has been declared as a variant of interest since March 2023. Likewise, SARS-CoV-19 was declared in January 2020. May I ask the Honourable Minister whether he will ensure this time that the most at risk, particularly the dialyzed patients, those with comorbidities, be given absolute priority for any sequential vaccination that may come up should any vaccine be found to be effective against Arcturus. And also his ministry...
No, this is not a supplementary question. If you read your standing orders, Honourable Member, you would find that a supplementary question is asked to elucidate, to clarify. But you're asking, it's more than a private notice question, what you're asking. So limit yourself to the first part, let the Minister reply.
Yeah. Mr. Speaker, sir, let me inform the Honourable Member about the WHO recommendation on variant XBB.1.16. WHO indicates that this Omicron variant has a competitive advantage over previous circulating strains and spread more rapidly. The global risk assessment for this variant is low compared to the previous XBB 1.15 and the other currently circulating variants. On the other hand, WHO indicates that to date, in countries where the risk of infection by this variant is significant, namely in India and Indonesia, there is a slight increase in the number of bed occupancy, but relatively less than observed during previous waves. Moreover, the disease has not been observed to be more severe in those affected by XBB 1.16 strains. Mr. Speaker, sir, in regard to the vaccination being offered to the whole of the population. It is at this time, it's not a question giving priority to whoever, but it is being offered to the whole of the population. It is how the population also adhere to the current vaccination program against COVID-19.
And I also ask the Honourable Minister whether he will consider to have a study correlate on one hand complications and on the other hand deaths associated with COVID-19 with regard to status and type of vaccines received, and if not, why not?
Mr. Speaker, sir, regarding the any research or any study to be done, it depends upon, this is confidential information of a patient, so it all depends upon how we can maintain confidentiality of information and how we can produce results. So, and this also, it will depend upon the ethics committee to approve any study in this respect.
Honourable members, the table had been advised that the following PQs have been withdrawn. B416, B419, B420, B447, B453, B455, B458, B460, sorry, B466, B477, B480, B485, B488, B494, B424, B449, B476. Whole question should go. Honorable 2.
B415.
Mr. Speaker, sir, I'm informed that provisions for cleaning services is made by the procurement section of my ministry through the Central Procurement Board. A 2-year contract was awarded for the provision of cleaning services, toilets, bathrooms, and sluices at hospitals and other health institutions on 19th November 2019, renewable for a further period of 1 year upon satisfactory performance at the total cost of 105,481,224 rupees, inclusive of VAT. At the expiry of the 2-year contract in January 2022, arrangements have been made with the service provider to continue the service on a month-to-month basis on the same terms and conditions. In the meantime, a new procurement exercise was initiated, and I'm informed that the exercise is presently at evaluation stage at the Central Procurement Board. Mr. Speaker, sir, with regard to the execution of the contract, some 300 cleaners are deployed on a daily basis in 20 health institutions for cleaning services. The health institutions for cleaning services, the performance of the service providers, as reported by the respective user departments, have been found to be satisfactory, except for some shortcomings such as absenteeism or lateness of the crew, or the non-wearing of uniforms or identification badges while on service. However, performance assessment was mainly focused on the cleaning aspect of the contract at this stage, and penalty clauses have been applied for non-compliance of service. Mr. Speaker, sir, I'm informed that a number of explanations were also submitted to the National Audit Office with regard to proper monitoring and strict measures to ensure an acceptable level of cleaning. For example, the National Audit Office was informed that the attention of the service providers has been drawn that one supervisor should be posted at site over and above the cleaners, and to provide the required number of male staff as stipulated in the contract. The service provider has provided uniforms and badges to all cleaners. Regional hospitals should ensure that the service provider submit character certificates for all cleaners and are required to keep an updated database of the national identity cards for all cleaners to determine age eligibility and strict monitor sign attendances. Management meetings are held with the service provider on a regular basis, including the chief hospital administrator from headquarters, and occurrence books have been provided at hospital for cleaners to record their arrival and departure times. Moreover, since January 2022, a vendor rating mechanism has been introduced, and henceforth all suppliers are rated on their past performances so as to maximize value for money and in selecting the most appropriate bidder. It is primordial to emphasize the importance of ongoing monitoring and evaluation to ensure that security and cleaning services at hospitals remain effective and efficient. This usually includes regular audits or inspections to identify any areas where improvements can be made, as well as ongoing training and education program to ensure that security and cleaning personnel are up to date on the latest best practices and protocols.
Thank you, Mr. Speaker, sir. According to the National Audit Report 2021-2022, and the Honourable Minister also mentioned it in his reply, a month-to-month contract was opted for. Can the Honourable Minister please advise why this option?
Mr. Speaker, sir, the Minister had no other option to ensure service delivery. However, a new procurement exercise has been initiated, as I've already stated in my reply, and launched at the level of the Central Procurement Board through open national bidding. So this evaluation is being conducted at that level, the CPB level. So far, still we don't have got the another contractor. We have to maintain the present contractor on a month-to-month basis.
The table has been advised. Some further questions withdrawn. B417, B429, B443, B473, B492, B493. Honourable members, I suspend the sitting for 1.5 hours.